everyone. Today we are going to talk about NIHSS or Stroke Assessment Scale. So NIHSS is an internationally accepted tool for assessing stroke severity of stroke, and that is used in patients suspected of acute stroke. And it comprises of a 15-item neurological exam, and this is used to evaluate the effect of an acute cerebral event on the levels of consciousness, language, neglect, sensation, visual field loss, extraocular movements, motor strength, ataxia, dysarthria. And patients may not be suitable for thrombolysis when the NIHSS is less than 4, and they wouldn't be suitable for a mechanical thrombectomy if the NIHSS is less than 6. If the stroke, that essentially means the stroke might be mild and the neurological deficits might not be enough to cause the patient difficulties, and this doesn't essentially mean that they would go with hyperacute intervention. And these are essentially scores used by the stroke specialist and the stroke specialist team who would decide if they would be for hyperacute intervention if the NIHSS is more than 4 or more than 6, depending on the neurological deficit. But for today's purposes, we are checking how to do NIHSS on a normal patient who does not have neurological deficit and whose NIHSS would be 0. Please use MD Calc for NIHSS scoring and interpretation. Thank you. Hello everyone, we're going to assess a stroke NIHSS assessment today. Hello, my name is Shweta, I'm with the doctors here. Can I check your level of consciousness? I'm checking the level of consciousness here by asking a couple of questions. Hi, would you like to tell me your name, please?
Hi, my name is Osama.
He's keenly responsive. I'd like to test your memory by asking you a couple of questions, if that's all right. Could you tell me what month we are in at the moment, please?
We're in October.
Yes. And can you tell me what is your age, please?
I'm 27 years old.
All right. Okay, so we would like to ask you to do a couple of things. Could you open and close your eyes for me, please? Well done. And can you try to make a fist for me? Open and close your fist for me, please. Thank you. All right. Now I'm going to assess the best case. So I would like you to keep your head still, and I'm going to ask you to follow my finger. Follow my finger without tilting your head, please. All right. Thank you very much. Now I'm going to assess your visual fields. I'm going to ask you to look at my nose, but I would like you to close your right eye with your right hand and keep looking at my nose. And when you see my hand wiggling, like from the corner of your eye, I would like you to say yes. Is that okay?
Yes. 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 Yes.
All right, thank you. Now can you swap your hands and swap your eyes? And when you see my hand, can you say yes for me?
Yes. 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 Yes.
Thank you very much. All right. Thank you. We're going to test facial palsy now. Could you give me a good smile? Show me your teeth. Well done. Thank you. Can you raise your eyebrows up for me? Well done. Thank you. Now we're going to check upper limb motor drift. Can you lift both your arms up like this for me for 10 seconds? Keep your eyes closed, and I'm going to count 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Thank you. You can open your eyes and relax your arms. There was no pronator arm drift. Now I'm going to check leg motor drift, one leg at a time. Can you bring your right leg up, left up in the air for 5 seconds? Close your eyes. I'm going to count till 5. 1, 2, 3, 4, and 5. You can relax. Now lift your left leg up in the air for me. Keep it up for 5 seconds. Close your eyes. 1, 2, 3, 4, and 5. You can relax your left leg. Thank you very much. We're going to test ataxia. Now, can you touch my tip of my finger with your index finger and then touch the tip of your nose? Now back and forth. I'm going to move my finger. Keep touching back and forth. Thank you very much. And try with your left hand. Touch my finger and tip of your nose and back and forth. I'm going to move my finger Well done. Thank you very much. Now I'm going to assess your lower limb ataxia. With your right shin, right heel, can you try and touch this knee and bring it down your shin, please? And back and forth. Thank you very much. And you can relax now. And with your left heel, can you touch your right knee and slide it down your shin? Back and forth now for me, please. Thank you very much. That's fine. There is no ataxia in the lower limbs or upper limbs. And now we're going to test the sensation. I'm going to use a pin for this test. I'm going to check on your chest first. How do you feel? Do you feel slightly sharp?
Yeah.
All right. I'm going to ask you to close your eyes. I'm going to do it down your arms and your legs. You have to tell me if you feel the same, okay?
Okay.
All right. How does it feel? Does it feel the same as your chest?
Yeah.
Right on this arm?
Yeah.
Does it feel the same as on your chest?
Yeah.
All right. For this purpose of the same session, I'm not going to expose your legs, but for the real purposes, please expose the legs when you're doing this. Does it feel the same as on your chest?
Yeah.
Does it feel the same as on your chest?
Yeah.
All right, cheers. Thank you so much. All right. Now we're going to assess language or aphasia. Can you tell me what this is called, please?
Pen.
All right. Can you tell me what color is it?
It's blue.
Thank you very much. For reference purposes, please look at MD Calc evidence section where you can look at other examples you can use for patients. Now I'm going to check dysarthria. Can you repeat a few words for me? Baby hippopotamus.
Baby hippopotamus.
Thank you. Can you say British Constitution?
British Constitution.
That's all. Thank you. Now I'm going to check extinction or inattention. I'm going to first check your visual inattention. I would like you to look at my nose and without tilting your head, I'm going to wiggle my fingers. I would like you to either say or point out which fingers are wiggling, okay, or which hand is wiggling. All right?
This one. This one. Both.
Thank you very much. Now I would like you to close your eyes. I'm going to touch your arms. I would like you to point out or say to me which hand I'm touching.
This one. This one. Both.
Thank you very much. I'm going to check, keep your eyes closed. I'm going to check your legs.
This one.
Which legs am I touching now?
This one.
And now?
Both.
Thank you very much. Now open your eyes. Now I'm going to come closer to you and I'm going to check your hearing. Keep your eyes closed. I'm going to rustle my fingers. You tell me if you hear the same on both.
Yeah, same.
Thank you very much. And thank you very much. And there is no inattention or thank you very much. We have finished our examination of NIHSS or Stroke Assessment Scale. For this patient, which we have done the full examination for, the NIHSS is 0. For your interpretation, please refer to MD Calc application, which you can use from your phone, and please use that for interpretation and scoring. Thank you very much.